Have you ever wondered why some children seem to develop hearing challenges while others do not, even from a very young age? A child's risk for hearing problems can be significantly increased by several key factors, ranging from genetic predispositions to events occurring during pregnancy, at birth, or in early childhood. These risks are important to understand because early identification and intervention are crucial for a child's development. The primary reasons behind these increased risks often involve delicate structures within the ear or complex neurological pathways. For instance, genetic factors can directly affect the formation or function of the inner ear, leading to hearing loss that may be present at birth or develop over time. Conditions like connexin 26 mutations are a common genetic cause. Additionally, complications during pregnancy, such as certain infections like cytomegalovirus or exposure to ototoxic medications, which are drugs harmful to the ear, can damage a developing baby's auditory system. Premature birth, low birth weight, and conditions requiring intensive care after birth can also contribute due to the stresses placed on a newborn's fragile systems. Understanding these risk factors means that parents and caregivers can be more vigilant in observing their child's hearing development. If your child had any of these risk factors, such as a family history of childhood hearing loss, received oxygen through a ventilator, or experienced a serious infection like meningitis, it is important to communicate this to your pediatrician. This information can help healthcare providers recommend appropriate monitoring, such as more frequent hearing screenings or diagnostic evaluations, to detect any issues as early as possible. For instance, a child with a history of recurrent ear infections, especially those with fluid buildup that persists for several months, might benefit from careful observation and potentially medical intervention to prevent long-term hearing difficulties. One insider detail to be aware of is the term progressive hearing loss. This refers to hearing loss that worsens over time, sometimes due to genetic conditions that manifest later in childhood. Another important concept is unilateral hearing loss, where only one ear is affected. While often overlooked, even hearing loss in just one ear can significantly impact a child's ability to learn, understand speech in noisy environments, and localize sounds. Ultimately, recognizing the factors that increase a child's risk for hearing problems empowers parents and healthcare teams to work together effectively. By being aware of genetic links, prenatal and perinatal complications, and early childhood illnesses, we can ensure that children who might be vulnerable receive timely attention, leading to better outcomes for their communication skills, education, and overall well-being.